what you're saying is that the diaphragm woke up one day and said, I just don't want to work anymore. So what you're saying is the diaphragm is the root cause. So if you fix the diaphragm, everything else gets better. I would say if the diaphragm has a problem, there has to be something else going on. And since you're talking about posture and they have crappy posture and they're hunched over or whatever, they sit hunched over a desk or whatever, and that posture is driving the diaphragm to be dysfunctional, then it's not the diaphragm that's the root cause. It's everything else that put the diaphragm in that position that's the root cause. So the way we get the diaphragm to function normally is to increase or improve the posture. So now the diaphragm doesn't have that pressure on it. Then we can move, then we can breathe, then we can do all this stuff. So same thing goes again for the people that are into this myofascial release crap, okay? So remember, fascia is not a contractile tissue. Fascia does not dictate anything, okay? If the muscle is functioning normally and the person is going through a full range of motion and they're doing what they're supposed to do, functioning and doing all that kind of stuff, then the fascia can't be a problem, okay? Because the fascia moves in relationship to how much the muscle moves. So if the muscle doesn't move and the muscle is stuck in a short position and it can't contract and get longer and get shorter, it's stuck here and it's stuck like that for a long time, and then the person doesn't move, especially in the transverse plane, then the fascia can get tight. So then that's where these myofascial people come in and say, oh, well, then you just need to break up the tight fascia. Really? Well, the fascia didn't get tight first. The fascia got tight last. So that means it's not the root cause. The root cause happens first. So what happened first? The muscle was dysfunctional. They stopped moving. They didn't have muscle elongation shortening. Then the fascia gets tight. So the root cause is the muscle is dysfunctional. And why is the muscle dysfunctional? Because the nervous system is not driving the muscle function, so it's dysfunctional and or inhibited. That's where we should start. Not with diaphragms, not with fascia, not with tendons. Tendon, you should never be treating a tendon. The tendon is never the root cause of anything, okay? Torn ligaments, not the root cause of anything. Somebody comes in with a lateral ankle sprain, tear, 3rd degree sprain, I'm not gonna treat their ligaments. Their ligaments tore because the primary stabilizer, which is the muscle, didn't do its job because it was dysfunctional, because it was inhibited, so it missed the contraction at the appropriate time, which means inappropriate stress was put on the secondary stabilizer, which is the ligament, and that's how the ligament tore. So trying to treat the ligament isn't going to do jack squat if we don't ever fix the root cause, which is the dysfunctional muscle. Okay, so these are the conversations that you have to have with people to get them to understand no matter what they're doing. If they're treating tight muscle, inflamed tendons, swelling, lack of range of motion, whatever, if they're not going to get to the root cause, they're going to continue to treat those things forever with limited results or plateaued results, and then they can't get past that plateau. Okay, so my advice for this PTA was ask questions. See if your clinical instructor can answer those questions. When you're watching my videos and he's got the vault, so he got the vault for free. I said, if you want to have your coworkers, like if they're asking questions and you're answering questions and I cover that in the vault in a video that's in there, have them sit down and watch it with you. I'm putting out this information so we can fix our profession. If everybody just sits on their hands and goes, oh, that's nice, and doesn't share it with anybody, A, you're not going to implement it because you're not having conversations with people to elevate your career. You're staying stagnant because everybody around you is keeping you down. And B, we're not going to change our career. If I just sit in this room and only talk to one person, I can't get the message out to the masses to say, this situation needs to be fixed. And I think if I polled every PTA and every outpatient orthopedic physical therapist in the country, I would guarantee if I polled them and said, is our profession a bunch of elite clinicians that are treating people and getting to root cause and restoring dysfunction? Or is our profession stuck in the 80s and we're doing dumb shit because nobody pays attention, and that's what somebody else told us, and that's what insurance pays for, and that's what the doctor put on the referral? Which one of these would they choose? I would say at least 75% would choose that our profession sucks. So what if 75% of all of the clinicians out there finally started talking to each other and saying, we need to find a better way, and I will share this with you, and they say, oh, this is a better way. Maybe in 10 to 15 years, we can fix our profession. But we can't do that if you guys aren't sharing information, you're not having conversations, you're not pushing people past their comfort level. That's what this whole membership is about, okay? So number one, if you are in the shift, and so the other thing that this guy brought up, which is a fantastic point, is he said, well, you make this look too easy, so I have a hard time believing it's real. So ask somebody who's been through the shift how easy it is. The reason why I make it look easy is because I've been doing this for 20 years. Actually, more than 20 years. It took me 2 years to come up with it. I've been doing it for 20 years after that. I've taught it to numerous people. I talk like this every frickin' day. So it's really easy for me to talk about this. It's really easy for me to treat patients. It's to the point where treating patients is boring because rarely do I have somebody come in that's really pushing me off of my comfort spot that they come in with something that I haven't already seen. So it looks easy, but ask anybody who went through the shift, it's not easy. You've got to reprogram your entire thought process and base it off of something that you've never based things off of, science. Okay, so thank you for saying that's easy. Hopefully you guys that are watching think that I make it look easy. It's not easy. That's why it takes 4 months. You want easy? Do a dry needling 2-day seminar. Do a cupping 2-day seminar. Do a K-tape online seminar. That's easy. That's why everybody has those designations and those certifications. It's all crap. So if you want to push yourself and get to the point where it's easy for me, like it's easy for me, there are practitioners out there that have been doing 180 for 3-4 years, been on every Zoom call, have watched every video, and now they're at the point where they make it look easy. Okay, so long rant, wanted this to be like a 4-minute video. We're pushing 11. Hopefully you're still here. So if you've got people that are asking questions and you have if you're in the vault or you have access to a previous webinar, or you have Mostrability, or you have the success guide, and you want to sit down and share that with somebody so they can see what you're talking about, that's the only way you're going to get out of the mess that you're in. The only way you're going to get out is to find other people that think like you and work with them, and then actually get in the shift so that your little community can join our bigger community, and then we can fix things for the global community. Talk to you later.